Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, well, in keeping with a theme that we've introduced continually over at least half a year now, maybe even longer, microcurrent is now playing a prominent role, at least in this office, and countrywide in trying to reverse medical issues. Many times they are pain related, sometimes they are not. But what power behind this thing called microcurrent? And we're learning about a new device that we're launching and really feel that it made an impact in the microcurrent market and will be coming and be featured here at this office. And training is coming to town. I mean, so much is happening with Avzzia that we just had to pick up on the theme and bring a little more to you today. Now today, we're going to have a gal with us. Been to Pittsburgh before, was in our training course with us in April that we held on frequency-specific microcurrent. But she's been involved as a medical professional. She's a registered nurse that now has moved into the arena of treating with and training those who want to treat with the Avzzia units. Her name is Nancy Anderson, and she's going to be our guest today. We're going to get a different perspective. You've met Lynn Teachworth. You've met Mike Legal. You're going to be meeting a lot of the Avzzia family, and thought that Nancy, who is been in Pittsburgh and coming back, and will also be here over the festivities in August that we announced the other day with the training of Avzzia units. Well, you're just going to have the opportunity to meet her face to face. You needed to meet her on the show so you get to know one another. Nancy Anderson, our guest today. The topic is Avzzia, the medium microcurrent. You'll be amazed at what this device can do. More on that throughout this morning and in the course of our discussion with Nancy. If you want to call in to ask a question or to make a comment about microcurrent in general or Avzzia treatment with microcurrent in specific, dial us up by going to your phone and punching in these numbers, 412-825-6262. That's 412-825-6262. I will give that number additionally throughout the hour. Now, the way the rest of this month is shaping up, on Friday, we're going to open them up on Friday, but, they went and did it again. They, of course, being the medical community, and just once again, another blurb is it on Medium. In fact, this was in the Trib Review, page A3, but they're taken down. They're going after mammograms again. It's my tripwire topic. It always gets my attention, and I just remembered as I looked at the article that I'm going to talk about on Friday, there must have been now 40 total articles over the last 8 years. Not one of them, not one, has sung the praises of this study. And as ladies who are potentially victims by their doctors to get the study, that's just one more reason to tell them no thanks, or no mas, in the words of the great Roberto Tarrant. Anyway, Friday we'll open them up, and I will bring you that little vignette on the mammogram, because you know what's going to happen. At the end of September, as we go into October, they're going to be out there. They be in the conventional medical community selling this snake oil like they do each and every year for National Breast Cancer Awareness Month. I love the awareness. I hate the study. More on how badly I hate it on Friday. Training and, no, I guess a better way to put this is the invitation to a tasting for Beresha is going to be in my office on the 16th, which will be next Thursday evening at 6:30. We've been having our Beresha reports and letting you know about this unique line. It's been a while since we've given you the opportunity to sample the stuff. You'll be able to do so in my office on the 16th, evening 7th, excuse me, 6:30, and also get a discussion of the eye treatment programs that we do so many of here now in this office. And we're going to be launching the disc, the release of the disc that I put together with all the shows we have done within the last, and they're very recent, within the last 30 to 45 days. We've learned so much about how well we can treat eye diseases that we just had to go to production. Many of you are very interested in this component of our practice, and you would enjoy having a copy of this disc. It won't be launched, it won't be released until that evening. And if you come and enjoy the tasting with us and a discussion on the eye treatment program, we're going to give you a free copy of the free disc. I think it's a very nice little gift to you, and just showing my appreciation for you coming out. Speaking of eye programs, we conduct one each and every month. We've been doing it since July of 2013. We do so with the full knowledge and awareness of and participation with Dr. Edward Condrat, ophthalmologist extraordinaire, the world's only homeopathic ophthalmologist. I didn't even think that was possible, but let me tell you how possible that is. The programs he's put together are able, as you should know by now, to reverse very serious eye diseases in 3 days. We conduct these 3-day programs. The next one coming up is this month in July, on the 20th through the 22nd, for the 3-day programs. And those have to do with the retinal diseases. You know the ones, MACD. Of course, I keep abbreviating it. It's macular degeneration. Give it its full respect. Whether it's wet or dry, it's still macular degeneration, or glaucoma, or retinitis pigmentosa, or diabetic retinopathy, or macular pucker. The list goes on and on and on, but the common thread among all those diseases is they're all retinal, which leads to a complete incapability for the conventional medical community to treat them at all. No reversal of loss of your vision. If you've got one of those diseases, it's a pretty difficult place to be in, because what you're confronting is either slowly or quickly sliding down a hill where your vision gets lost and never to return to original again. Well, Dr. Condra couldn't have any of that. He put these programs together 14, 15 years ago. They are non-invasive. They are non-injection. They are non-surgical. They're non-everything except the ability to get them reversed in 3 days. You should know about this by now. Certainly if you listen to this show, you do. If I'm catching you by surprise, learn more a couple ways. Head to our website at pittsburgheyeprotocol.com. There you'll find a description of our programs, how to get a hold of us, and then we link onto the Dr. Ed Condrat website because we are his northern affiliate. That website is Healing the Eye and Wellness Center, and I guess the address is healingtheeye.com. It now is in Fort Myers, Florida, but we are the northern affiliate. Each and every person participating in the eye program has Dr. Condrat intimately involved with them and their eye issues one-on-one, and is participating with us to develop the devices and the frequencies and the programs that are unique to just you. So more on this subject, head to the website at pittsburgheyeprotocol.com. If you got any specific questions about this, why don't you talk to Sister Sarah? You do that by dialing up the phone number direct to her at 724-993-0500. That's 724-993-0500. Now, we've just recently, and this will be our third group, launched a cataract correction program, and we run them at the same time. It's just the cataract program, believe it or not, is 1 day longer. It's a 4-day treatment program, but they're still having excellent results with reversing cataracts at the end of the 4 days. And we have Dr. Lisa Bowen, who's going to do the evaluation, both beginning and the end. We're really proud of our accomplishments here. And so if you want to be involved with cataract treatment, if you do not want, and there are a group of people that absolutely do not want that eye surgery. I see some people out there just run to it and looking forward to it. I really think you need to put surgery at the very, very end of the selection process of things to do. You just didn't know there was a way to avoid it completely, and I think that find out more. You also want to go to PittsburghEyeProtocol.com and talk to Sister Sarah. Once again, that number 724-993-0500. Just a little peek into the future now, because the August program, which will pretty much round out the summer until we move into the fall, that eye program is going to be held 17, 18, 19 for the 3-day, and 17, 18, 19, 20 for the 4-day if you are a cataract patient. And we'll give you, as the time moves on, the September and fall schedule as we make it up. But once a month, we do have these programs for you. What else? Oh, plenty of information to gather on the subject of eye issues in the most recent publication of the Journal of Lifestyle Medicine, the spring edition. Now, we should be having a summer edition soon, but the article I wrote for the spring edition is entitled, of all things, The Cataract Cure, and up and coming other two yet to be written articles in future editions. We've been involved with this publication since its inception, and there are plenty of great articles in it. You want to get some past issues. We have them all here in the office. They're free. Come on in and get them. The Top Doc series. We've been involved with the Top Doc program now for just about a year coming up. When we first met in Phoenix, Arizona a year ago for the 20 top alternative docs in the country, we met out there and had a wonderful time presenting chapters that we had written, all 20 of us, in a book. The book is available. It's a hot item, difficult to keep in stock here. It's quite a collector's item. You may want to get a copy of it. Of course, you can add to it the most recent publication on not 20 top docs, but 17 top docs on chelation therapy. This was just put together most recently in March, released in March of this year. So the Top Doc series available here in the office. We've got both books if you'd like to purchase them, and they will be great additions to have on your dining room table or your coffee table, I guess is a better way to say it. Vitamin C kits. Hey, look, they're going like hotcakes, folks. If you take vitamin C and you want to make certain that you get a form of it that you can assimilate, meaning actually get it into your bloodstream, but of course have it come and be derived from safe donor substances, and corn isn't one of them, because that's where 99.9% of all vitamin C comes from. Then you want to be involved with getting a hold of Sister Sarah to discuss the kits. 2.2 pounds of powdered citrus-derived vitamin C combined with lecithin coming from a non-soy derived source. We've watched and minded our P's and Q's here. We have a healthy product that when you mix them up, make them congeal, and will have you allowing to assimilate about 100% of what you take in. You can't get anywhere near that with the over-the-counter water-soluble forms of vitamin C. And the kits are going like hotcakes. We even throw in, by the way, the last of the assembly line items to make your own liposomal vitamin C, and that is once you've mixed these items up, you congeal them by putting them into an ultrasonic jewelry cleaner. Well, we got the cleaners, and you got everything you need to get started. Give us a call here at 724-942-3002 if you have an interest in getting one of these vitamin C kits while they still last. Takes us a while to put them together. We still got plenty left to go for this round. All right, let's do this, folks. Let's take a short break. In the interim, hopefully switch gears to meet our guest today. We've been talking about microcurrent a lot, and a unique company with a unique device called Avzzia. Well, one of the well-known trainers and utilizers of this device is our guest today. Nancy Anderson will be with us in a moment. Be right back. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health, heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today in a Wednesday morning version of the show, and with a theme that we keep on bringing back because, well, we're just learning so much about how it is able to help a tremendously large number of our patients in a way that, quite honestly, we've never been able to help them before. Now, you've met quite a crew from the Avzzia family. Mike Weigel, the CEO of First Alternatives, the main marketing division for the Avzzia units. You've met Lynn Teachworth, and by the way, he's Pittsburgh bound in the month of August. We are happy to allow you to meet another one of the Avzzia family of instructors and trainers and all-around go-to people when it comes to learning more about Avzzia. Her name is Nancy Anderson. She's our guest today. We're going to have a little surprise guest, too, along with her, a patient she's brought along to describe how well Avzzia has worked for her. But before we get there, let's meet Nancy herself. Good morning, Nancy. Welcome aboard.
Good morning, Dr. Courtney. How are you?
I'm doing wonderful. It's so nice to see that you were able to come and spend some time with us today. Now, we've met before. You were nice enough to come to Pittsburgh for an April conference where we had a training on frequency-specific microcurrent. And you represented Avzzia in the room as one of the vendors. And since then, we've become very intimately involved with Avzzia, and we're really going to promote and sponsor more and more on this particular modality and use of microcurrent. But as I normally do when meeting a guest for the first time on air, I know a little bit about your background. Why don't you share with us your background and how it is that you've moved through whatever steps you've taken professionally to arrive where you are now? How did it all happen, Nance?
Well, let me first say I'm honored to be on your show, Dr. Courtney, and it's been a great experience meeting you and your crew and having you be exposed to this technology. It's very exciting. And how I got started, well, let me start back. I have a bachelor degree in nursing. I was an operating room nurse for a number of years. About 10 years ago, I started studying energy medicine or bioenergetics medicine or microcurrent technologies. I've done a number, including the frequency specific, as you spoke of, among other things. And about 2 years ago, I had another frequency specific practitioner call me and say, "You've got to see this technology. You won't believe it." Well, I went to a trade show where they were, and one of the practitioners worked on me, and I knew immediately it was like nothing I'd ever experienced in my life. And I actually said, after my treatment, a few minutes later, I said, "How much do I write the check for?" Because I was so utterly impressed. Since then, I still can't believe the results that we get from this technology. I mean, every time I work on scar tissue and I watch the changes right in front of my eyes, I'm like, this is crazy. How can this happen? But it does. And I'm so excited. I feel so dedicated to get this information out to practitioners as well as to patients, but mostly practitioners because they will be able to get the word out and they will be able to make the differences in the changes in their patients. And I'm really in looking at scar tissue. I've written a course and teach a course called The Treatment of Pain Associated with Post-Surgical Scar Tissue. And scar tissue in post-surgically is not really addressed that much. And there are so many surgeries, breast surgeries, back surgeries, abdominal surgeries, that the scar tissue, as you'll hear from Jennifer, the effects that it can have on your body long term. So it's really something in my heart that I need to get out there.
Well, look, let me ask you this, and let me back up just a little bit. And you have a unique perspective because you were in the realm of FSM, frequency-specific microcurrent first, and then there was an allure to you to take a look at a form of microcurrent that isn't frequency-specific. So I know my listeners are very confused about this, frequency-specific versus not. How do you answer that question? Could you take a shot at that question and help me and my listeners become more aware of the difference between the two?
Yes, and it's not just those. I think that a lot of the microcurrent technologies are very valid in what they do, whether it's an alternating microcurrent, square wave, or it's a direct current, or if it's what the Avzzia is, a sinusoidal waveform. And each one of these affects the body differently. I still use frequency-specific microcurrent for specific things. I find it works best. It's a piece of the puzzle that I still use. I use the Avzzia for other things, and those things with the effects of the sinusoidal waveform are just incredible because the sinusoidal waveform actually stimulates what are called the nociceptors, which are the nerve endings in the tissue. And they're in the musculoskeletal system, they're in the organs, they're in the body that are stimulated, the A, B, and C fibers. That's the A delta, the B fibers, and the C fibers. I know I'm getting too technical, but other technologies don't do this. And it's very significant in what they do because it's all about healing. Even acute nociceptors are stimulated. In chronic, we re-stimulate those nociceptors and set up like a cascade in the body that makes the body think that this is a new injury. So we see in part changes in the tissue just because of that. You're drawing attention, the nervous system, to this tissue and reconnecting it to the brain.
Okay, so you had mentioned previously, and certainly I've become aware of the great role that the Avzzia microcurrent plays in the treatment of scars. Could we just for a moment, I know people sitting listening to us right now, maybe even looking at a pretty unsightly scar of their own, and to them, and to me, to be quite honest, for the longest period of time, scars meant just that. It was a cosmetic blemish. It didn't appear well. It detracts from the whole image of continuity and contour in the body. Yet scars play a very prominent role in a treatment regime using Avzzia, far and above and beyond the cosmetic. Could you take a moment and maybe describe for our listeners why scars play such a large... It's the starting point. No matter what you come in with, we start looking at the scars first, whether you talked about them or not. We're going to ask you about them. Why are we going to do that, Nancy?
Well, I think that people see the scar as a superficial tissue. When you cut into and make an incision, like in a surgical incision, especially deep into the abdomen, or deep you go in back surgery, they go into the dura. Or they go into thoracic cavity for open heart surgery. You're cutting through layers of tissue that is affected. And when they close it all up, all you see is the superficial part of it. And it's all those deep tissues that are affected, and also the adhesions that occur underneath that. Jennifer's story is quite interesting because she had a liver resection. And actually, when I looked at her scar, superficially, it didn't look so bad. It wasn't discolored. It was white. She'd had a number of different kinds of treatments. And, but when I palpated, when I felt superficially and then deeper, you can feel those deeper layers, especially in the abdomen. When they cut through all those muscle and fascial tissue and down into the cavity, sometimes what happens is those layers, instead of gliding over each other, they actually stick together. So what you're seeing in an incision is the pulling of that tissue. And that has far-reaching effects in the body because everything is connected. And abdominal incisions can actually pull the fascia that will cause back pain because it's connected to the spinous process in the back, in your spine. And then the adhesions that adhere to the wall inside. So there's many factors and changes that we've seen, our practitioners were able to see changes in the actual, not only superficial, but feel the lower ones, and resulting in some of the, as Jennifer will tell you, the release of adhesions.
Now, we just got to we have to meet Jennifer now. Oh, she's waiting in the wings, and so nice to come aboard today as an example of someone who was introduced to the Avzzia because of that scar. And why don't you set it up for us and introduce us to Jennifer, and we'll let Jennifer describe her own experience with the Avzzia.
Okay, Jennifer Hornberg is a practitioner. She and her husband own the Center for Wellness in Orlando, and we met at an expo in Orlando as we were both exhibitors. And she came up to me, and I started to treat her scar. So I'll let you go ahead, Jennifer, and you tell him your experience through the audience.
Good morning, Jennifer. Welcome aboard. Thanks for bringing your personal involvement with this device. It looks like it went much further than just being treated. You're now a trainer yourself, so you're really immersed in this. Take us to how it was first introduced to you, what you anticipated to be able to have happen, what actually did happen, how long ago that was. We're all ears now, Jennifer. Please tell us your story.
Well, I love telling the story. I'll tell the story all day. First of all, hi, thanks so much for letting me come and talk about it. People closest to me are tired of hearing the story over and over again, so I'm happy to have new ears. So let's see. Yes, Brian and I, my husband and I, own the Center of Wellness in Maitland, which is just north of Orlando. And so we have acupuncture, massage therapy, trigger point relief. We were using microcurrent devices of our own at the time. And so we were vendors at a health expo. And actually, Nancy, not to correct you, but you talked to me first. You came up and you started talking to me, and I was thinking to myself, wow, this woman is so smart. That was my first thought. And whatever she's talking about, I'm really not the scientific one. That's my husband. But I thought, whatever she's talking about sounds really interesting. So, owning a facility, owning a clinic, we have people approach us often with their devices, their gadgets, and we are not exactly gadget people. We're traditional Chinese medicine, which is, usually outside of the gadget realm. Mm-hmm. So I said, I sent over to Brian, and I said, you guys talk the science stuff, I'm going to stay in the booth. Well, about 30 minutes later, Brian came back and said, you have got to go let them work on your scar. So side note, in 2001, I was diagnosed with 2 malignant tumors on my liver. And at the time, I was 30 years old. So that was really shocking. And it was a long, hard process. But essentially, in 2004, they did a complete liver resection and took out 75% of my liver. The scar at that point went from breastbone to just above belly button. and then sliced all the way across my right quadrant
Sure.
abdomen. So it was a long recovery. The scar did not heal properly. The staples did not heal properly. It was a very very traumatic, emotional, physically difficult journey for me. But I healed, and here I am. And so that surgery actually is what started me on the alternative healing path, and looking at different methodologies and what's going to help me be the strongest, healthiest person that I can be. So fast forward back to January of this year, so 10 years, almost 11 years later, I meet Nancy. My husband convinces me to go in the middle of a health expo, lay down on a massage table, pull up my shirt for the whole world to see my scar, which, like Nancy said, it's not that it was colored. We've actually done a lot of work on my scar with various microcurrent, with acupuncture. I've had trigger point release. I've had adhesion work. I've had a lot of work on the scar. So it physically on the outside did not appear, it wasn't horribly heinous, or, we didn't need to cover our eyes and fear, but what I can say is that for those 10, 11 years, I have had no feeling in that area whatsoever, no feeling at all on the scar or about 2 inches outside of it. So I laid down on the table. He picked up this Y-bar antenna-looking thing and put it on my abdomen. Within 30 seconds, Dr. Courtney, 30 seconds, I had feeling in the scar.
Wow.
30 seconds. And Nancy, I think that's when I started to cry. I just started crying. And there were, a good, 20 people hovered around sort of looking in, and it didn't matter to me. The emotional release that occurred, on top of the physical activity that was happening, it was very impactful for me. And like I said, I'm not a gadget girl. I'm not easily impressed. But number one, Nancy impressed me. And then number two, as soon as she touched me with the Avzzia, I was blown away. So then as she's working on me, and I think, Nancy, you probably worked on me for maybe about 30 minutes that day, if that, maybe 20 to 30 minutes. Now, one of the side effects from the scar, the adhesions that you were, is all up through my abdomen, over my right pec, and up into my right shoulder. I had these adhesions. So what had developed for me over the past about 3 to 4 years was essentially frozen shoulder. I wasn't able to lift my arm up more than, directly out in front of me. My range of motion was extremely limited. As she was working on me that day, I was feeling pop, pop, pop in my shoulder. And I'm sure, Nancy, my eyes must have been as big as platters looking up at her. And I said, I'm having popping sensations. Is that normal? And she said, it's probably adhesion. Well, sure enough, it was. And so over the course of the next, it was about 3 to 5 days, after one treatment, I had full range of motion in my shoulder.
Get out.
And I still do. That holds today. And, same thing. I work in the clinic. I own a clinic. I get worked on at least 2 to 3 times a week. But this is before the Avzzia came into my life. So we had been working on the shoulder, on the scar, so the immediate result that I received from this device was so powerful that, that was it. I said, I don't know what it is. I don't know where it comes from, but we need to find out. We have to be involved in this. And our patients have to be involved in this. And, I was just telling someone the other day, this device has literally changed the way that our clinic treats and manages and deals with patients with pain. With scars. I mean, it was truly a life-changing experience for me.
Now, your frozen shoulder, as you described it, you clearly relate it to the surgical intervention when it came to resecting your liver, because maybe the retractors that were used, or I don't know how it is or was, and maybe you want to take a stab at it, explaining how you now look at this. What was it in the surgery that you think led to the frozen shoulder, And it did develop immediately after the surgery, huh? And then 11 years you had this problem?
No, well, the frozen shoulder didn't start to develop until about 40 years ago.
Oh, okay.
3 to 4 years ago. And what several experts have shared with me is what they think is that the adhesions and the scar tissue just simply blocked it actually started in my just above the scar, to the right, underneath the right pec up in there. That's where the adhesions started to freeze. And then it just managed over time and use. And, I had a baby and then I had an injury. I fell down a flight of stairs. And so they think that all of that together just created this mass, almost the way that someone described it to me, that was like a web of these sticky adhesions that were, it was pulling my shoulder down toward my right shoulder down towards the scar.
Sure.
Not to mention the fact that these scar adhesions, like Nancy was saying, through the actual scar themselves that we're going through, my lower back pain was through the roof. And I think that's the thing. I was hearing her say that, and you too. We look at these scars and we think, oh, okay, I have a scar, and okay, so I won't be wearing a bikini anytime in the next 40 years, and that's okay. But we don't think about what damage, cutting through the muscle wall, cutting through, all of these things, and then that scar tissue that builds up and gets, as we age too, I think it gets more, I think of it as congested is how I felt inside. And, I had very limited range of motion. I do yoga. Trying to do some of these poses was impossible for me. And now I feel, almost better than I did when I was 30. So it's amazing. It's fascinating.
Well, and if I heard right in terms of chronology, this was in January of this year? It's not too long ago, is it?
No. And that's the thing. So it was the end of January. I think it was like, the third week in January that I met Nancy, was introduced to the Avzzia. It took me about 3 weeks after that treatment to wrap my head around what had happened that day. And still sitting here talking about it, some days it's still sometimes, it's almost like a movie or a dream, because it was just so impactful. That one 20 to 30-minute session had such an impact on my life. Now, not to say that I haven't had treatment since then, because that was the first thing we did was buy a machine for the clinic. And we call it our Avzzia addiction. We all fight over the Avzzia every day. So I use it quite frequently now. But yeah, it's been 6-7 months since I've been introduced to this, and it is now a permanent fixture, not just in my life and my practice, but in my family. We have a 4-year-old and a 2-year-old. And any time they fall down or get any kind of a boo-boo, the first thing they do is they call for the Avzzia.
They call for it.
I want the Avzzia.
That's wild.
It's just as common in our house as Band-Aids. We use it every day.
Well, let me ask you this, Jennifer. Here you are. I mean, your husband and you are involved with I'm going to guess, a very large practice treating all sorts of medical issues, and you purchased a unit not to just use on yourself. You're using it in the clinic. Anything that you've seen that you would like to report to our listeners which sort of parallels your own experience? Are you finding this happens to others with the same rapidity that it happened to you?
Yes, and it's funny. I was thinking you were going to ask that, and I've been trying to come up with just one story. I have so many mind-blowing success stories. But most recently, we have a patient who has severe foot pain, knee pain, foot pain. He a former athlete, and surgeries between the scar tissue, some neuropathy, some wear and tear, ligament issues. He had been in excruciating pain for almost 10 years. And, she shared with us her daily level of pain was right around an 8.
Wow.
This is pretty common for us. We deal with a lot of folks who live in chronic pain. And, and as you can imagine, that impacts your life on every level. And she, in her job, she stands the majority of the time. So this is a challenge for her. And she comes to us, and her affect is very, she's very low. Her energy is very low. Her facial expressions are very, sad and droopy. She's just in a bad mood. I mean, she's in a level 8 chronic pain for almost 10 years that impacts you, on an emotional level in your relationship. So she had been coming in for acupuncture and had good success. She was down to about a level 4 to 5 consistently. And then she agreed to let us use her as a guinea pig, essentially,
Okay.
with the Avzzia. And, so we, my husband was actually working on her, and it was an hour, 15-minute to an hour session. And she was skeptical, as some people are. She was, as I was, honestly, so I get it. And then she stood up. Now, we have wood floors in our clinic. She stood up off the table very gingerly. She has special shoes, orthopedic shoes that she wears. She stood up, stood all the way up, and she sort of bounced her knees a little bit. And we were kind of watching her face, holding our breath, because you just never know. And tears started pouring down her face. And said, "Are you in pain? Can you describe what's happening?" And she said, "I'm standing barefoot on a wood floor, and I have no pain. I have no pain."
And that was a first, huh?
Laughing, and she was hugging us, and she, and it's these stories, these people, this impacts her life. Now, that's not to say that she won't, need more treatments, because this is at least a 10-year chronic, like me. These are chronic situations. I'm certainly not saying that a half an hour or an hour treatment is that's all you need and it's going to magically shift everything. Certainly there are follow-ups required, but in that moment, to see this woman smile, I had not seen her smile. It's amazing.
That's an easy one to remember then, and the numbers you've helped, a 10-year problem, and miraculously, and although obviously she needed to be further treated, bet you you couldn't wrestle that Avzzia unit out of her hand. She probably bought one also, continues to use it.
Absolutely not.
Nancy, by the way, these are fascinating stories, Jennifer. Your own story certainly was captivating, and now that you're able to treat others and you have a visual reference almost daily to see this going on, you are completely sold, as it were, on the concept of this form of microcurrent. Nancy, you've been doing this for a little longer than last January, or this January, and you have probably countless numbers of stories that are equal to Jennifer's story. And how would you, to our listeners today, how would you describe how they should be taking this, knowing of their own personal issues and maybe previous surgeries that they have had?
I'm sorry, say that the first part of it again?
Yeah, we've got listeners right now who are very intrigued hearing Jennifer's story and hearing Jen tell about what she sees every day on a daily basis. You've been working with this company for many years now, I get the feeling. And so people always enter with a bit of skepticism, and you're able to peel that away in the highest percentage of cases. What should someone who's listening us today do if they have similar issues and trying to get over that skepticism?
Well, I think if you look at traditional westernized medicine and you see the normal treatment is either you go to the doctor, they either send you to physical therapy, they give you pills, or you have surgery. And when you really start looking at the body in a different way and you're not getting results with those, they have to realize that the body is not what we think it is. It is a field. It is tissues. The soft tissue dominates what holds the structure together, the skeletal system. We always think, oh, something's wrong. It's wrong with your shoulder joint. wrong with your hip joint, your knee joint, your back vertebrae joints. But in reality, it's all soft tissue. So if you think of soft tissue as the culprit, and statistics say 80% of pain is myofascial, that's muscle fascia pain, just like Jennifer's retraction of that myofascial tissue, those planes of tissue that carry throughout the whole body. It's all connected. And this technology works on that soft tissue. And changing the dynamics of the soft tissue that's retracted from scar tissue or repetitive use, you change the dynamics of that, and it changes the alignment of the skeletal system, and you end up having less pain in your joints because your joints are balanced. So it's looking at it in a totally different perspective, but also this is what they call now quantum physics, and we're addressing energy, bringing energy into the cells to function better, as well as changing the tissue itself, like we see with scar tissue. And this isn't just open wound, this is closed wounds, bruises, fractures, sprains. Those create scar tissue. And the more inflammation you have in your body, the more prone you are not to heal properly. You're more prone to have fibrotic tissue. So we have to start looking at the body and addressing the soft tissue.
So now, as a clinician, when people come to see me, I can utilize some pretty sophisticated technology that Tim Smith put together for us, and I can pretty much determine if I'm going to be able to help somebody very rapidly. You can pretty much tell right off the bat how successful you're going to be. And is that a fair assumption that a person who's going to get an Avzzia treatment can expect to feel something or know something pretty quick?
Well, I think as a practitioner, there are different things that you do. I always include my patient in my assessment with range of motion, whether your range of motion, if you're working on a shoulder or your head and neck or whatever, range of motion, and also palpation, feeling the tissue. I have my clients, when I feel the deep tissue, they don't even think about it. They always think of the superficial scar. And when I have them participate and make themselves after the treatment and I reassess, they will see that there's a change in that deeper tissue, the way their body, when they stand up, the way they feel straighter, or they're less, that congestion or that feeling is gone, or the range of motion has increased. So those are the things that you look at for your patient to know that there are changes. And I see it, even just the feeling that this technology gives with the feeling of well-being, because of the stimulation of the nervous system, and it is. They will feel a change, and it's also the practitioner communicating with them, what they might feel.
Now, Jennifer, you work in the clinic that your husband operates, and you see an awful lot of people come through. Is the Avzzia something that everybody gets a crack at, or has utilized for them? Or if not, what percentage of people that you're seeing, and I'm going to presume a lot of them are pain-related issues, what percentage of patients do you see in your clinic that have been able to be helped by the use of the Avzzia technology?
Sure. Yeah, I'd say of our total clients, our total patients, about 60% of them have experienced the Avzzia, and I'm literally trying to think here. I don't think we've had one treatment where someone hasn't been affected and felt a difference and experienced like a wow moment.
Okay.
So yeah, I don't think I honestly can't say that I've had anyone not respond in a very positive way. People keep rescheduling, so that's our gauge.
Yeah, absolutely. You want to have more of that. That's a great testimonial overall on the success that Avzzia can provide people. That wow moment. Certainly, you were wowed by being worked on for the 30 minutes when you met Nancy, but others are being wowed daily at your clinic. And we're so happy. We're just recently coming on board now. We're going through the wow period ourselves and seeing how helpful the Avzzia technology is. And listeners today, by the way, are more than likely going to be the next patients that come in and try it and maybe experience their wow moment. I'm looking forward to it. Nancy, are you going to be inbound? Are you coming to town for the up and coming August? What is it? A massage therapy convention here, and I know Lynn Teachworth is going to be in town, and Mike's going to be in town. Are you, Jennifer? You're not coming to town, are you?
Oh no.
Okay. All right.
It's the home. I've got.
You got the two little ones. What about it, Nancy? You going to come to Pittsburgh or not?
I'm not sure. I think I was scheduled to be in Orlando at another event at the same time period. So unless that changes, right now I'm in Orlando.
By the way,
I want to add one thing is, as a practitioner, and Jennifer, I'm sure you'll agree, you never get over the wow. I still am, every time I get goosebumps and I say, oh my gosh, I can't believe it does this. And the client, we're both going, wow. So you never get over that because it just continues to change. It's just amazing. I described it to one person. I was abroad and they didn't speak very good English. And they said, what is it doing? And I said, it's magic. So I don't know how to describe it in some ways, but it is, you'll never get over the wow.
Well, that's fair enough. Look, we're wowed by listening to the two of you. Nice enough to come to board today and let our Pittsburgh audience share with what you've. By the way, what is it about Orlando? There appears to be a glut of Avzzia trained and Avzzia enlightened individuals in that central part of Florida. Is there some reason for that? Did I get a misread?
The sunshine. It makes us.
It makes us happy.
It makes us happy.
I think there's a big group coming into that area with this expo. We met a lot of incredible people that are looking forward. They're looking at the future, and they realize a lot of these practitioners were acupuncturists, and we're so excited about them coming into this family that we have with First Alternatives. And because we're learning off of each other and we're getting the word out. And it's a very exciting place. There's a lot of, forward-thinking people. So Orlando is a great area, for sure.
Well, it certainly is. And, of course, First Alternatives is based out of Orlando, and it just looks like there's a cluster that's formed around there. We want that same cluster up here in Western Pennsylvania, and I know that I know Nancy for sure is going to help us get there. And, Jen, I wish you all the success and luck with your own clinic. Looks like you're well on your way. Thanks to the both of you for coming aboard this morning and allowing us to learn from you how the Avzzia technology may be beneficial to them.
Well, thank you for allowing us to come on and share our experience and get the word out. That's it.
The word will be far-reaching from today's little encounter, and we'll keep spreading that word. Best of luck to the two of you. Hope to meet you soon in the future, Jen. And I know, Nancy, I'll be seeing you quite a bit in the near future.
Okay, thank you, Dr. Courtney.
Thank you. Bye now. Mm-hmm. There you have it, folks. What a great sort of personal look at how the Avzzia approach to treating all sorts of things. Starts with that scar. That when you get Avzzia trained, by the way, and there is a training coming up for those of you, especially practitioners, that may be listening to me today, and you're wondering, oh my goodness, I think I got to learn more about that. There's an opportunity coming for you. It was launched. We mentioned it just the other day. Mike Legal, who's the CEO and president of First Alternatives, has scheduled a training session here in Pittsburgh, Pennsylvania. It's going to be on August, I'm checking my calendar, I'm making certain, I think it's the 23rd. Yes, August 23rd. And what's going to happen is there's going to be a national convention for massage therapists here in Pittsburgh in the week preceding it, starting on the 19th of August, and it ends on Saturday the 22nd. Now, we thought it was very appropriate if a massage therapist was going to be at the show and they purchased a unit, if they could be able to be trained while they were still here in Pittsburgh before they arrived home, they could be hitting the ground running, so to speak. And so for that reason, it was just a natural to go ahead and offer the training right in the tail end of the massage therapy convention. But of course, if you're from Pittsburgh and not necessarily even having attended the massage therapy convention and you wanted to be trained, you also can piggyback onto that. This training is going to be held all day on Sunday, the 23rd of August, and it will get you ready to utilize the devices that you've, well, you may not even have selected the device yet. You may be waiting to try to determine which of these units you want to purchase. But the training is going to be available. To find out more, you can give us a call here at 724-942-3002 and just say, look, you'd like to get more information on this program up and coming. We'll have some additional Avzzia encounters here on the radio show as we approach the mid-August. It's only a month away, folks, so it's going to happen pretty doggone quick. And the training, first time here for Avzzia, we had a conference on training with frequency specific in April. We did not have a training on Avzzia. There are many people in the group who wanted to become trained, and hopefully they'll take us up on this offer in their own backyard. For those of you out there that are thinking, oh, you know what, maybe that technology will help me, you want to come on in and see us here at the office so we can find out if you can have a wow moment or not with Avzzia, with your own particular issues. And it just, oddly enough, don't feel, well, don't be surprised when whatever you come in with and whatever you tell us is bothering you, that the next conversation we enter into is to talk about any scars that you may have, surgical scars or trauma-related scars, because they more than likely are playing a role in the complaint that you bring. And that's probably the take-home message of today. Scars are where we start with, and there's no product, no device that works as well on releasing them than the Avzzia unit. Now, the Bill with the chopsticks in the background says it's our time out of here. I enjoyed spending time with you today. Look forward to seeing you on Friday. So until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.